So I'm here at Ranscock 2018 with Charlotte Elder, who presented this morning on trans-affirming healthcare. You're from the Mercy in Melbourne?
Yes.
Can you tell us a little bit about what trans-affirming healthcare is and why it matters?
So I suppose I'll answer that question backwards. So the reason that trans-affirming healthcare matters is that we know that transgender people have worse outcomes across physical, mental and emotional well-being, and we know that trans-affirming healthcare will improve those outcomes. And we also know that there's no evidence of long-term harm from trans-affirming healthcare. So that's why it's important. And looking at health outcomes in trans people who are denied access to care, their health outcomes are uniformly lower than other Australians, and it's not fair. They need to have the same opportunities as everyone else. So from the point of view of what trans-affirming healthcare is, it's different for every individual, but essentially it's allowing someone to access care which will let them live their lives to the full. So sometimes that's just social support, sometimes psychological supports, sometimes it's hormonal therapies, sometimes it's surgery, sometimes it's all of the above. We also utilise physiotherapists and speech therapists and other allied health areas. Some trans people choose to access assisted reproductive technologies. And so it's different for everyone, and everyone's journey is different. However, having the access to it is what's important.
So what's the experience been at the Mercy with this?
So the Mercy's started seeing, I suppose, a slow trickle of transgender patients over the last few years, and we've been really working hard to look after them in a way that's supportive and caring and non-judgmental, and to change the processes around the hospital so that trans people feel comfortable coming to our service, and also to upskill all of our staff members. So it started out with just the gynaecologist, and it's merged through to everyone from the telephonists and the food services staff to allied health to the clerical staff, so that people have the skills for interacting with transgender people and not feeling like they're floundering, and not leaving the transgender people feeling judged or like they got inadequate care.
You touched on some of the specific, I guess, gynecological or ONG specific issues with transmasculine and transfeminine patients that you need to be aware of. Could you talk about some of those?
So it's different for every patient. However, for the transmasculine patients, often the problems are very similar to the normal gynecological patients that we'd see. So problems with pain, problems with bleeding, problems with endometriosis, and needing surgery such as oophorectomy or hysterectomy. For the for the transfeminine patients, it can be complications of neovaginal creation, so things like strictures and granulation tissue, and there can also be issues with screening for STIs and breast cancer in potentially in both groups.
So you also talked a bit about why you wanted to talk about this stuff today and in this public forum, and you touched on, I guess, some of the public debate around or publicity around these issues. How do those things intersect, the public debate and these health outcomes?
I think the main thing about that is that it's really important that doctors are informed and gynaecologists know about healthcare and are able to see through the politics and actually look at the person in front of them and look after them and give them the best evidence-based care. And I think that's why it's really important to talk about these things in a scientific meeting in the context of we're healthcare providers and we need to give good evidence-based healthcare. And I think that's why it's really important. Certainly there's been a lot of conversations in the media about transgender issues and transgender people, but I think it's really important as doctors to separate ourselves from the politics and to care for patients.
That's interesting, because I guess some other perspectives on that were I saw on social media where people were talking today about these sorts of issues highlight the fact that doctors should be more, I guess, passionate advocates for their patients, or do get involved in the politics of these issues. What do you view?
Yeah, I mean, I think I suppose it kind of goes both ways. I think there is a role for advocacy, and that's where bodies like RANSCOG can really step to the fore and do important things. There's also the Australian-New Zealand Professional Association for Transgender Health that does some fantastic advocacy work. But I think my role here today was really to empower individual doctors to care for the person in front of them, and through spreading that awareness, allow individual advocacy to flourish.
Thank you so much for your time.